Australia's Chief Medical Officer says he expects about 2 million Australians will contract swine flu this winter. Confirmed cases of the new strain of H1N1 flu are adding up, and health authorities say they'll soon be multiplying. It's estimated between 10 and 30% of the population will get sick, and virologists say there may yet be Australian swine flu deaths. Karen Barlow reports.
The flu and you.
Television has become the latest weapon in stopping swine flu.
You can minimise the spread of flu by covering your mouth and nose when you sneeze or cough, disposing of used tissues in the bin.
But the new strain of H1N1 influenza is establishing a foothold here. There are more than 60 confirmed cases in Australia, and thousands of people from the cruise ship which brought in at least 18 cases are in voluntary isolation.
Well, we've just spent 9 days together on the cruise ship. So coming home and spending another 7 days together, it's great. It's really good.
The Pacific Dawn is now parked off Willis Island, east of Cairns. 3 crew members have flu symptoms and authorities don't want the ship to dock. New South Wales is now treating all passenger ships as if they are carrying the virus.
It's as if that's an affected country.
The Prime Minister is expecting the number of cases to take off over the next few days.
The Australian community should prepare for the number of swine flu cases to continue to increase, consistent with the pattern that we have seen in other countries around the world.
That pattern includes possible deaths.
We do know that this swine flu has a quite hard edge to it. That is, a small proportion of cases can be much more severe. And we have seen that in some of the deaths that have occurred, for example, in the United States.
Health authorities say so far all cases in Australia are mild, although it's understood there are several swine flu patients in hospital. Some virologists say this strain is being underestimated.
So we will certainly see deaths from this virus. It's just that at this stage the number of cases is so low that it's hard to pick that up.
Australia's Chief Medical Officer, Dr Jim Bishop, is now expecting 10% of the population, or up to 2 million Australians, to get sick. However, there are even higher estimates.
I think we could see anywhere between 10 to 30% of the population getting sick from this virus. We could see quite a high number of deaths, higher than normal seasonal flu. We will see our hospital systems and healthcare systems stretched to the maximum, and we'll see high levels of absenteeism from the workplace, from school. It will be disruptive to normal societal functioning.
Even in a mild form, swine flu could seriously hurt the economy.
Given the results from our earlier work, it could be around $2 billion lost from the economy. Most of that comes from people staying away from work.
The Reserve Bank board member and academic has compared the current swine flu to the major pandemics of the last century, including the severe 1918 Spanish flu outbreak.
This appears to be quite a mild influenza outbreak, similar to a standard influenza cycle. And we have enough information to make some rough estimates, and it is billions of dollars.
Businesses, even small firms, are being urged to plan now for pandemic disruptions. They're also being reminded they have a duty of care to their staff to help stop the spread of the disease. Karen Barlow, Lateline.